Neurodivergence affects the whole body and nervous system, and let's talk about it. As therapists, we're taught to investigate the whole body and the whole nervous system, but what if I told you 1 in 7 of your clients are neurodivergent and they just don't follow neurotypical rules and they are living in this neurotypical world that for them is slightly more challenging and more complex? If therapists knew about neurodivergence, it may affect the way that they communicate with and treat their neurodivergent clients. Given the world is already so overwhelming for your neurodivergent clients, this course gives you an opportunity to really understand the lived experience of your neurodivergent body. So did you know that neurodivergence is linked with mental ill health, and that 50% of autistic people experience depression, and 50% of those with ADHD experience anxiety, and ultimately autistic people are more at risk of suicide than non-autistic people. And suicide is the leading cause of premature death for autistic people. There are many reasons for this, and some of this is because of their masking behaviour, because of the lack of support, and because they have difficulty identifying their own emotions and describing how they feel. We have to start understanding the lived experience of neurodivergence in order to improve their lives. Simple things matter, especially in our treatment rooms. We could start to understand their sensory sensitivities. Are they hyper or hyposensitive? What are their sensitivities and how does it affect them? So recently we've had a heat wave and you might have had a fan on in your treatment room. But what about if your client, this was an unexpected thing? You don't normally have that. Your client is really sensitive to the feel of the wind, and therefore in their treatment, they cannot concentrate on anything other than that sensation. None of your treatment is going to be effective, or they are not going to be able to calm their nervous system, because their nervous system is going to be completely overwhelmed with that one small change. And it may be completely impossible for your neurodivergent client to explain that to you. It's important that we understand what could be a trigger and how we adapt and respond to the trigger, and how we build relationships that support neurodivergent people. We could accommodate different communication styles and not assume social norms in order for our neurodivergent clients to feel more supported. If we understand the lived experience of neurodivergence, we can be more curious and we can better support our neurodivergent clients. If you want to learn more about neurodivergence and how best to support your neurodivergent clients, then I would love you to join me on this course.